Hello, my name is Amber Lankford, and my major at Bloomsburg University is a nursing student, and I'm going to receive my BSN. The project I chose for my POLISCI class was to do a presentation on the decreased global vaccination rate. Why I chose this topic. As I stated, I am a nursing major, and I find it important to have a healthy population. As a nurse, I want all my patients to be as healthy and happy as possible. Unvaccinated populations lead to an increase in disease, and an increase in disease causes more stays in hospitals and can cause more fatalities. And diseases can easily spread throughout communities. As a nurse, one of the roles I have is to educate others. So I find it important that we need to educate others on the importance of staying healthy, and one of these ways is vaccinations. So the importance of vaccinations. Many diseases, such as measles, can cause fatalities if you're not vaccinated. However, for measles, you can be vaccinated. So if you get vaccinated, you're most likely not going to get the disease. Also, if the majority of the population is not immunized, herd immunity decreases. Herd immunity is where the majority of the population is vaccinated, so others who are immunodepressed or immunocompromised who can't receive vaccines are protected. These include cancer patients receiving chemotherapy, radiation, or HIV patients. They rely on others to be immunized so diseases don't spread, they are not introduced to them. According to the World Health Organization, immunizations save millions of lives every year and is widely recognized as one of the world's most successful and cost-effective health interventions. The World Health Organization releases statistics on vaccinations every year. 2019 has not been released yet, so in this presentation I will show you 2018. Globally, 72% were vaccinated with HIV, which is for meningitis and pneumonia. However, there are other vaccinations that are below half of the population. This includes hepatitis B, with only 42% being vaccinated, and rotavirus, with only 35% being vaccinated. The closer we can get to 100%, the less likely we're going to have diseases spread globally, nationally, and even regionally. About 19.4 million infants globally do not receive their recommended vaccinations every year, and around 60% of that 19.4 million live in underdeveloped countries. Barriers of vaccinating children. In developed countries like the United States, parents have been scared of their children developing illnesses such as autism because of vaccinations. In the past, there has been a celebrity that released that vaccination caused autism. However, this was proven wrong by many studies. Our parents are still scared to vaccinate their children. In third world countries, there's a lack of access to vaccination based on the access to healthcare. This may be very limited in underdeveloped countries. Also, the cost of healthcare. Since there is limited healthcare, it may be very expensive to get the medication that is available. There also could be a lack of transportation to healthcare. If you're in a community that is secluded either by environment like jungles, you may not be able to get to the healthcare vaccinations that are being given out. There's also a lack of education about the importance of vaccinations. This is for developed countries and third world countries. So, who developed the Global Vaccination Action Plan? This is one way we can combat the decreased vaccinations around the world. Through this plan, they will provide more access to vaccinations in underdeveloped countries by 2020. However, they have expanded the time frame because they do not believe they will not hit the goals they want by 2020. They also want to strengthen governance and leadership of national immunization programs. They want to improve monitoring and recording of immunizations so we can keep track of who immunizations. We also, through this plan want to expand immunization in underdeveloped countries past infant immunizations, because if you are going to receive your vaccinations in an underdeveloped country, you are most likely to receive them only as an infant. We would like to expand that to childhood and adult immunizations. There also wants to be an increase in mobilized domestic funding so we can fund programs people can receive free or low income cost to receiving vaccinations. WHO also developed the World Immunization Week. This occurs the last week of April and is sponsored by WHO. Through this week, the importance of it is to educate people on the importance of vaccinations. They may do this by posting ads or posting articles about the importance of it on the web. In conclusion, decreased immunizations lead to more deaths throughout the world. Access to immunizations and lack of education about vaccinations has led to a decrease in vaccinated populations. To improve the rate of vaccinations, organizations like WHO can provide plans to increase access to vaccinations and educate the importance of vaccinations to all. And here are some references. Thank you for listening to my presentation.